Hi, I'm Miles Parker. I'm project lead for the agent modeling platform at Eclipse and also founder of Metascape. And in this screencast, we're going to follow the previous one, and we're going to look at a specific agent-based model to get a better understanding of how we can use ABM to explore complex natural and social systems. So what are the kinds of properties that we might be interested in, the qualities of these individual agents that we might want to represent in the model? Well, there are all these kinds of things that may make us more or less susceptible to disease. And of course, certainly part of that is whether we've been exposed before, what the different drivers for our overall health status might be, and so on. And then what sorts of needs we might have that will drive our interaction in space. Viruses have, for example, markers which might help the immune system identify them. How quickly might they reproduce, and what kind of damage might they cause to the host. And then if we look at the behaviors, this is how these properties play out, our various heterogeneous needs and state will drive how we interact with one another. And say behaviors learned behaviors in terms of whether we wash our hands or not, individually are going to have an impact on disease transmission. And as we've seen, a small subset of the population, for example, not practicing hand washing may have a significant effect on a larger part of the population. Viruses have a whole set of quite complex behaviors. And then there's this space, this explicit environment, and humans interact in all kinds of different spaces, right? So there's the physical landscape. There's this sense of sort of semi-permeable groups where I might live in a small town, I might get on a bus, then get on an airplane and go to a large town and come back, all of these sorts of things. And then there's information space. So if we're thinking about this in terms of public health and people making decisions about vaccination, all of those kinds of things, the interaction space, the social space is going to be critical. Then viruses, getting back to the multi-scale issues, what sorts of organ systems do they exist in? They're going to have, they may have very different activities in different systems. Very crucially, there are these very interesting issues with large genetic populations and drift and so on. And then, of course, they exist in a physical space, and that might also be external to the host. You know, they might be on a countertop or whatever. So going back to the three qualities that we were talking about of these kinds of complex systems that ABMs are designed to help us model, we see this interconnected quality and how a disease will ripple through a population. So it may be that that you have a single population and the disease, it goes through these sets of waves. Well, how does that occur? You know, why doesn't everybody get the disease at once? How does it come back? All of those kinds of things have to do with the fact that there are many different individuals who are interacting. There are these very interesting interdependencies. So here's this case where if we look at the dashed line in the earlier waves of the 1918 pandemic, if you see the curve here, and this is traditional for influenza, the death rate among much younger people and among much older people is much, much higher. And people in these sort of middle-aged groups have a very, very low death rates. And then all of a sudden you see this spike in 1918 in death rates among young, healthy adults. And what's going on there? Somehow the virus has mutated to an extent that it affects that age group much more strongly. that it triggers something in those individuals' immune systems, whatever. The fact is that there seems to be some kind of interplay between the virus population and the individual population across certain really massive scales when you think about it. And then finally, there's this quality where the pandemics are interrupted or have these bifurcation points. Popularly, people think about these as tipping points in terms of when disease, say, really takes off. But in fact, the paths of disease can be very different. We could see as we trace this out, if we went on the upper side, we can get a bifurcation point there and another one and another one. These are all sort of paths through time and space. We might imagine a path in space where a few people don't get the disease, don't transmit it to anyone else, and a whole subpopulation isn't ever exposed to that disease. So we need to understand all of these qualities. And in the next presentation, we'll look at an example model done on the agent modeling platform. If we look at an agent-based model, let's look at how we would do this in a traditional approach. So let's see, there's a Wikipedia article here on this classic model, which is the SIR model. It's susceptibility, infection, and recovery. And with this model, we can pretty well capture, actually perfectly capture, the classic epidemic curves. And so here, if we look at the top, at the blue section, these are all the people who are susceptible but don't have the infection, and that drops over time in kind of a classic S-curve. And over time, if we look at the green population, we see that the number of people that are infected goes up and up and up. And then if we look at the red population, we see that over time people recover. So that's moving from S to I to R. And so that captures the basic mechanics pretty well. You'll notice a few things here. You know, nobody's infected at the beginning, everybody's infected at the end. Here's the basic model, which is just a few ordinary differential equations here. Okay, but let's see. What if we're interested in looking at the population over time? Well, this is an important piece here. The system is nonlinear. We don't have a generic analytical solution. So basically, that means if we want to find out anything about the system, we're going to need to make some simplifying assumptions, and if we need to know more, then we're going to have to start to play some pretty complex games with these equations. Things rapidly, for me at least, get opaque here. We begin to have trade-offs between different dynamics, adding vaccination in and so on. We want to study exposed, that is, people that are asymptomatic but could still infect others. That's obviously an important piece. The equation gets more complicated. We need to deal with maternal immunity and so on. Dealing with age turns out to be apparently quite complex. So let's see. This says, in fact, they are infinite dimensional models. Since we have to deal with density through the ages. Well, it sounds hard, and this isn't the kind of model that's going to be very transparent to policymakers, but it's also quite difficult to understand and extend and play with in terms of the basic science. And finally, you're not really going to be able to explore the dynamics as they change and in different spatial arrangements and so on. So there have to be different ways to approach this that are better in some ways, and in fact they are. And we'll look at that next when we go through an agent-based model of this same kind of system.